Well, as we have been talking about, Niswonger Children's Network reaches far beyond the hospital walls, well into our rural communities in a variety of ways. Our next guest sees the difference that some of these programs make. We want to welcome Holly Rinehart, Chief Nursing Officer for the Niswonger Children's Network. And Holly, great to have you on Daytime. Thanks for joining us.
Thank you so much for having us today.
It's certainly a big day. It's really a celebration, too, of how far we've come.
It's such a big day. We're so excited. The Children's Hospital is just busy with excitement, and we're just so overwhelmed with the joy today.
And of course, we talk about the network, which kind of came, we were saying 3 years ago, that was that big launch at the Radiothon where they really explained what this network was and why it was important. So let's give our viewers some insight into the network and the variety of ways that it covers our communities. Absolutely.
So the network I'm extremely passionate about. That's one of the things that I get to work with daily. And so being part of the Niswonger network means that if you're taken care of at Niswonger Children's Hospital, or if you're taken care of at Norton or JMH or Greene County, you're going to receive that same level of care as if you were in Niswonger proper. So we have all of these wonderful team members that go out and provide education. We have physician groups that work on policies and protocols, just to be able to standardize that care throughout the region so that these kids get the exact care that they need.
And sometimes they're really a blanket effect, I think, for all of our children to learn about safety and protection, and for families.
Absolutely. So we have our early learning centers that we're starting to talk about today, and then we also have our safety stores that we have. We have one at JMH and then one at Niswonger Children's, and we have several teams that talk about safety. Bicycle helmets, swimming care, all of those things that we're able to provide the education across the system, and it's wonderful.
So what do you do then as the Chief Nursing Officer? What is your role in the network?
Sure. So I work with Niswonger Children's at nursing operations specifically, but then I also have oversight as to making sure that that standard of care is sent across the region with the network. So I work with different teams. We work with our OB leaders, we work with our pediatric leaders, our ED providers, to make sure that they all have that information for those policies and protocols that we can share amongst the region for these kiddos.
And it is a big region. I'm sure you do a lot of traveling, Holly.
Yes, we do. We have lots of people that are able to go out, and myself included, to be able to talk to those team members across every facility. So it's very exciting. Very fun.
Today is really our day to join together as these communities come together to raise money for all of these different programs. And of course, every year it seems like there's something, like going to one particular thing. Right. Where has the money gone over the years?
Gosh, throughout the years we've been able to provide so many services, one especially across the region, but specifically also at Niswonger Children's. We've been able to provide isolettes, beds for our children to sleep in. We have specialized equipment for monitoring techniques, IV pumps, syringe pumps, feeding protocols, all of those things that we've been able to provide. Child Life has been able to benefit from several things, and being able to provide that holistic approach for those kiddos and those families to make them feel safe with distraction techniques. So there's so many wonderful things that we've been able to do.
Yeah, you mentioned those Child Life specialists. I mean, what they do for the children at the hospital is just amazing.
It truly is. They're such a big part of our care team, and that's what sets us aside as a children's hospital, to be able to have those Child Life specialists. So they're very important.
Do a lot to make it a little less scary.
Absolutely.
Yeah, and then of course we saw that beautiful playground there at the hospital, which also was part of Radiothon.
Yes, the playground is so important. Those kids really enjoy it. It's a safe place for them to be able to get outside and enjoy those things that are in a safe environment, and it's such a wonderful thing to have there at the Children's Hospital.
And then you look at the growth of the Children's Hospital, like physically.
Yes, absolutely. And then we're working on our project, our Hope Rising campaign, which is the new NICU. So that's something that donations will be able to help with, and to be able to provide that equipment for that project is extremely important.
And what I love too is this is kind of that time where our businesses come together to donate, our families come together, and then I love to see the kids who have been helped by the hospital and some of those services, they come up with their own little fundraisers to donate.
They do, and that's such a joy to be able to see. That's the big part about the Radiothon that warms your heart, of those kiddos that come back and be able to share for whatever little fundraiser they've been able to do, and be able to give back. And that's such a huge part of what today and tomorrow will be.
Yeah, being part of the difference. Holly, thank you so much for joining us today.
Thank you so much.
Lots of great insight. We want to let everybody know it is so easy to donate, and of course that's what we're doing today and tomorrow. You can text the word KITE to the number right there on your screen, 24365, or you can call the number 855-611-5437. You can also visit the website for more information, and that's niswongerchildrensradiothon.org.